So the reason that I'm so committed to educating and screening and looking for those oral cancers or for the precursors or even high risks is because, first of all, it's kind of an unknown. It's kind of shocking to me to hear people come into our practice for the first time and first of all, say they've never had or known to have had an oral cancer screening. And that's something that I just don't really understand. I mean, who else is looking in someone's mouth? And unfortunately, cancer is now the leading cause of death instead of heart disease. Now it's cancer. And what we've seen is that mortality rates for all the other cancers are actually declining. People are living longer, and the only reason is because of early detection. But oral cancers are the only ones that haven't changed. It's like that just continues to be the same. And if we're catching it at a stage that you can see it with your eyes or feel it with your hands, it's usually a stage 3 or 4, and you have less than 50% survival rate for 5 years. Now, with the links of HPV and that being a hugely sexually transmitted virus, I think it's important for people to know. And therefore, I've really, thought this out and feel that it's not just about looking for something that's already there. There are people that are going to be committed to their health at all costs, and they want to know up front. So there's technology out there. We can do salivary tests that are quick and easy for people to know if they've been exposed to the HPV virus and have it, and if it's active. And if so, then those people need to be screened more often. Why wouldn't you? It's kind of like going in for a mammogram. If it's not normal, you're going to go in more often. If you go in for a PSA test, you're going to go in for your prostate checks. That's why people are surviving from those cancers, whereas with oral cancers are not. And one of the areas that I really feel strongly about is that we educate parents and we educate young people. Because at this point, getting them vaccinated with Gardasil or one of the 2 vaccines against HPV can save their lives. Doing that before they're sexually active and educating why it is that, abstaining from practices that will actually cause them to end up in higher risks. It's important. We've developed a protocol to be more proactive than reactive, and that's really important to me. I really think that's the way to go. And, we're working on being able to put some programs together to outreach to the public and to young people and to schools and anyone who will be willing to listen on how we can save lives. Because I unfortunately have had a few patients in my career that have come into my practice for the first time, and I caught something way too late. And losing a patient is not something that I'm willing to do ever again. I did not become a physician because I don't have it in my heart to deal with life and death. So that's one of the reasons that I'm kind of crazy about it. I think that it needs to be brought to the forefront of attention.